Well, hello everyone, and welcome to today's healthcare expert panel, where we will explore transformative onboarding and leadership training. We have a great session lined up for you today and are super excited to have you with us. While we give others a second to join here, please feel free to utilize the chat box and let us know where you're joining from today. Now let's go ahead and meet today's panel. First up, we have Todd Moran. Todd is the Chief Strategy Officer at NovoEd. He is a learning strategist and digital workplace expert with over 20 years of experience. His expertise spans educational technology, digital customer experience, change management, and employee engagement. He has worked across startups, nonprofits, and large multinationals, currently serving as Chief Strategy Officer at NovoEd. Todd holds a BA in organizational psychology from Middlebury College and an MA in information and learning technology from the University of Colorado. Welcome, Todd.
Thank you. Great to be here.
Next, we have Stephanie Stark. Stephanie is the Vice President of Service Excellence at Southeast Georgia Health System. She oversees patient, provider, and employee experience, learning and development, marketing, and performance improvement. As a transformational leader with over 20 years of experience, Dr. Stark has developed successful service excellence programs and leadership and staff development initiatives. Previously, she served as System Director of Customer Experience and Chief Learning Officer at Baptist Memorial Healthcare and Executive Director of Customer Experience at Wellstar Health System. Dr. Stark has been an adjunct professor at Baptist College of Health Services in 2013. Welcome, Stephanie.
Welcome.
Next, we have Dr. Grissel Hernandez. She serves as the Executive Director at Stanford Healthcare, leading nursing, workforce development, professional growth, and Watson Caring Service integration. She is also the Magnet Program Director and a board-certified holistic nurse and nursing professional development specialist. Dr. Hernandez earned her Ph.D. from the University of Colorado, focusing on creating caring environments for staff. With over 30 years in healthcare, her expertise includes continuing education, nursing practice, public health, and regulatory requirements. She is an accreditation appraiser and team leader for ANCC and a member of ANA and a recognized speaker and author on patient-centered care, staff development, and holistic health. Welcome, Grissel.
Hello, greetings from Stanford, California.
And moderating today's session will be Michael Rochelle. Michael is the Chief Strategy Officer and co-founder at Brandon Hall Group. Michael serves in a variety of roles, including overseeing research and advisory support for organizations and solution providers. Michael is one of the company's principal analysts covering all areas of human capital management.
Hi, everyone. Greetings from Boston.
Welcome, Michael.
Thank you.
We would like to give a huge thank you to today's webinar sponsor, NovoEd. Through cohort-based experiences, NovoEd taps into collective wisdom, placing each learner at the center of perspective, application, and expertise. Large enterprises such as 3M, GE, and Nestle partner with NovoEd to accelerate their critical initiatives, reconnect teams, and achieve rapid alignment through learning that is felt, experienced, and swiftly transformed into impact. Visit NovoEd.com to learn more. For those of you who are not familiar with Brandon Hall Group, we are a human capital management research and advisory firm that empowers excellence in organizations around the world through our research and tools. We have 6 practice areas, including learning and development, talent management, and leadership development. A quick mention that we currently have several certification programs open for enrollment, including our Certified Learning Strategist program. Visit certification.brandonhall.com to learn more about how to earn that designation. We currently have the following surveys open right now. Our 4 new learning assessments were recently launched this past month, along with a learning and development survey. You can visit www.brandonhall.com and click Open Surveys to access the complete list of available surveys. If you would like to join a panel of survey takers, please email us at success@brandonhall.com. And now a few logistics. To ask questions, please feel free to use the questions panel on your control bar. We will leave time at the end for questions. This webinar is being recorded, and we will share a link to the recording and a PDF of the presentation via email in roughly 24 hours. If you would like to download a copy of today's presentation instantly, the link to do so will be available in the chat shortly. The chat is also open for today, and we really hope you will share your thoughts and experiences as we go along in the webinar. Your feedback and perspective on what we present today and on your own experiences will make the webinar more valuable for everyone. So please join in on today's discussion and share your thoughts as we go through, or just simply pop in, say hello, and let us know where you're joining from today. And lastly, we will announce the winner of our raffle at the end of this webinar. The winner of the raffle will receive half off the 2025 HCM Excellence Conference. You do have to be present to win, so make sure you stay until the end. And without further ado, I will pass things off to Michael Rochelle.
Well, thanks again, everyone, for joining, and our esteemed group of colleagues and experts on our roundtable today. I think this is going to be a very interactive, high intensity, high impact discussion. And I strongly encourage you to ask questions in the chat. Our team will pick that up. This is about making sure that we're covering the topics that are most important to you. You have here in front of you the agenda. We're going to be kind of breaking this down piece by piece and allow our team of experts to kind of weigh in on these, what we think are super important topics that are taking place around the country in healthcare facilities of every size and type. Okay, so let's launch an icebreaker, and let's launch our first poll question, which is, what are the biggest challenges you face in training healthcare personnel? We'll give the audience about 20, 30 seconds to answer, and then we'll post what those answers are and have our team weigh in. Okay, so we can see here that what's really leading the group is lack of time for in-person training is a very strong challenge. I'll throw it out to our team of experts. How do we feel about how people answered? Any surprises? Seems familiar for you as well within your organizational setting.
I think all the questions are aligned with what we see.
I agree.
We're off to a good start then, and being able to tackle the things that are top of mind for folks. That kind of leads me to my first question, Michelle, is tell us about the business environment that you operate in every day.
Sure. Well, first, again, thank you very much for the opportunity to be with all of you today. As it was mentioned, I work at Stanford Healthcare, and we are a large academic medical center and organization. And one of the biggest challenges, the unique challenges that we have, is that our organization continues to grow. And we span our footprint in the Bay Area here in California continues to expand, which means that we have the challenges of having to provide professional development to a workforce that is 24/7, and it is spread out across many zip codes. So the idea of having to have in-person training, it is basically a thing of the past. The other thing is that in our strategic plan for our organization for the fiscal year 21 to 23 and continuing on 24 and for the next 3 years, we had two main strategic initiatives that we were working on as an organization and as a nursing department. And those were under our people to engage our staff, our employee engagement in the domains of wellness, education, workforce development, and inclusion, diversity, health equity, and belonging. The second one was around our care. So the care that we provide or the experience that we give to our patients and our families. And the domain that we wanted to work on and that we were focused on was enhancing empathy and compassion. So we were looking for strategies, innovative strategies within my department to integrate education and awareness around belonging, diversity, inclusion, and also from the perspective of a compassionate workforce. So those were some of the challenges and some of the great kind of space that that we had to work with in our facility.
Thanks, Grissel. And Stephanie, how about yourself?
Well, I echo Grisel's sentiments. Thank you so much for having me on here today. But I think, you know, I wouldn't say we're so unique. We are a community-based healthcare system. So like Grissel mentioned, I think we're all looking for growth in terms of we continue to grow in the services we provide in the areas in which we serve. We primarily serve 7 primary counties, 2 hospitals. We also have a strong medical group and long-term care centers. So that's a little bit about our makeup. But I think our challenges aren't unique to many today right now. The one thing is, of course, we see the work becomes more complex every year. Patients are sicker, newer diagnoses. We have the introduction of many, external threats and opportunities with the, rise of technology and care. So how do we get everyone up to speed and ensuring that they're competent, while also dealing with the challenges of a rising in agency staff utilization and staffing shortages across the nation, doing more with less. And we, trying to balance those things with also then identifying how do we still develop our team? How do we invest in them to get that engagement and to be able to achieve, all of the opportunities and the outcomes that we desire? How do we get there? How do we achieve those things? And so I think for us, it's really been, how do we align education with our organizational outcomes? Is there true alignment in that strategic objective so we can see here's the why and here's the impact it's having? The second piece is, how do we meet learners where they are? Because like the poll just showed, trying to pull a staff member off the floor is near impossible. We used to really focus on brick and mortar live training, and now we realize it's just not effective. People can't get off the floor. We're not seeing that participation. And we're also seeing that learners don't want to learn that way. So trying to change with the times, as well as continuing to grow and dealing with all the challenges, I think that's kind of where we are right now.
Stephanie, I think it's fascinating, this idea, what you're experiencing, both you and Grissel, of the expectation of folks coming in and learning. And it shouldn't always look like the days of old, where it has to be classroom based. You're pulled off floor, you're put into a sort of fixed environment while you're still thinking about the sort of operational needs. And then there's a huge cost to that too. So it's fascinating. I know we're keeping the focus here on this domain, but that is felt and shared across all of our clients. And I love your statement too about this idea of aligning to outcomes of the hospital, outcomes of the network you're driving at, which maybe wasn't as top of mind and maybe in years past. We're seeing that universally.
Mm-hmm.
It's a fair point, Todd, and I think it's important that we kind of take a look at all of these things. And I think, Stephanie, in conversations I've had with you, I think we'll circle back on that change management aspect of things as well. But let's launch another poll question. Let's find out more what the audience is thinking. And our second poll question is going to be, how effective are your orientation and leadership development programs?
we should be telling people it's a safe environment, right? They can be honest and candid with us. It won't go outside these walls. We should.
And I encourage everyone to ask any questions that you have as we go through this roundtable, and want to make sure that what's top of mind for you is top of mind for us. Okay. Not a surprise for me. Somewhat effective. I think that's where a lot of organizations land, even out the arena of healthcare. How about our team of experts? Does that surprise you? Particularly the small percentage of folks that feel they're effective with their orientation and leadership development programs.
Maybe we're asking the wrong target audience. We should ask the people who were participants in the onboarding process. I think that we have opportunities for growth. I think we all, I think that all departments like mine want to think that everything that we teach, it's effective. That's why it's so important to get feedback from participants so that we get to know what really works for them. To Stephanie's point earlier, not the way that we were teaching before is no longer effective, and it's not the way that people want to learn. You know, we're not, Stanford is an academic medical center, but we're not a nursing school. And, you know, we are teaching adults, and we need to be agile in the way that we teach. And we're not here to, we're here to enhance already people who come with knowledge, and we are enhancing their learning based on the policies, procedures, and, you know, new technologies that are coming into the organization or into the workforce. And there has to be more ownership from the participants to own their learning process. And we're not teachers, we're not the sage and the stage, we're facilitators of learning. So it'll behoove us to have technologies and tools in place that helps us with that. I don't know, what do you think, Stephanie?
I completely agree with you. I also think it's in terms of, I love that you mentioned the word agile. I'm a huge proponent of agile learning theory, you know, in the sense that we can't continue to say, oh, it's working, let's keep it this way. It's got to be constantly changing and adapting to the audience, to the needs of the organization. You know, how are we measuring how well we are? Oh goodness, sorry, my computer went on mute all of a sudden on its own. You know, how are we measuring the effectiveness of the training and development? Are we getting that feedback, like you said, from that front line who's getting it? How do we know it's effective? Are they changing behavior? Because I think, you know, the traditional evaluation methods of saying, you know, did you like the training class? And, you know, was the room nice? You know, they don't help us. They don't give us any feedback. But did you change your behavior as a result of this? And did you see an improvement in whether it was a competency or an outcome? You know, that's what we really need to be looking at. And I think that's where it's different than before. And so, you know, that's where I would say, if we looked at everything across the board, we'd probably say, yes, it's, you know, it's satisfactory right now, but can we all do better? I think definitely.
There's some great, please, Michael.
Now, Stephanie, I think, kind of circling back on something that came up previously, is we're all trying to figure out what that number one skill is that we need to train on. And I think a lot of times we talk about particularly competencies and skills that are known to us. But one area in particular that's interesting is change management. Seems to affect every healthcare person today. In that evolution of where hospitals are going, what's changed to make that basic operational training insufficient for the needs like addressing change management? for example? What do we need to be thinking about there?
You know, I think there's so many different things. So, just to touch on a few. One, healthcare is the second fastest growing industry in the United States today, and it's spurred on by the first, which is technology. So as we continue to infuse new technology, new research into healthcare, we have to change practice. And so, that's one change. And then we're looking at the current model, how we've operated in the past due to, the onset of COVID changed, I think, how we all did everything. And we haven't gone back to, it's everybody kind of the new norm because no one ever went back to what it was, but staffing models look different. How people learn is different, how people interact and engage. We had a whole group of students who came out of nursing school, for example, who never even had clinical rotation because they had to learn on simulations. We had to train them differently than someone who has 10 years of experience. And so especially as a healthcare leader right now, you're leading so many change initiatives that if you aren't taught that skill set of, really how to identify your stakeholders and engage and how to, communicate effectively and all those components that we know, basic kind of change management skills, you won't thrive in this environment. It's constantly changing, and it's getting comfortable with that change and helping others to get comfortable that will lend us to success.
Todd, you had perspective here that would be great if you could share.
I do, and I think it's fascinating because it aligns so closely, Stephanie, with what you just laid out. And Michael Love just posted a note where, in his mind, maybe it's a slightly broader arc of number one skill beyond just change management. And it's this idea of sort of this meta, this ability to sort of learn and evolve, that being the number one skill, which for folks, that follow, and obviously the learning science is near and dear to my heart, and sort of the andragogy, Grissel, of meeting these adult learners who expect to be part and parcel of their experience, not just be sort of dictated to, that set of top 10 skills coming out of the World Economic Forum back in 2020, forecasting to 2025. The number two skill in that was that meta skill of the ability to learning strategies. And so I think that's a huge part that couples tightly with change management. And it's an expectation that we have absolutely in healthcare, but I think also even more broadly for workforce populations.
Let's jump into another question for the audience, another poll question. Which skill do you think is the most important to develop by healthcare professionals today? I think we've got a good solid conversation going around that, but let's ask the audience directly which one they think is most important. Okay. Communication and teamwork. Not a surprise to me. This is tantamount to any organizational setting, especially with the matrix-oriented approach to work, having to work with colleagues, shoulder to shoulder, and some of the other important aspects of just making teams work as high-performance teams. Does our team of experts want to weigh in on what we've learned here?
I'd love to just
Go ahead, Ted.
help. No,
No,
it makes me think when we were talking a little bit offline, I think in our first, as we gathered as a group here, and I remember, Stephanie, you recounting this idea of breaking down silos. The skills that we need are to accomplish that end is to sort of, which would seem odd if you would think that any place would be incredibly connected, would be the nature of a well-oiled sort of hospital system, but that being still a challenge, a real challenge today. And so what are the skills that help support and need to be developed at sort of that human level to address that outcome of breaking silos? And I don't know if you would still hold to that or not, Stephanie, as being a big challenge.
I mean, I would think that it is. I defer to Grissel too, but we're still seeing departments working kind of independently, and even though they work together to transition or to do, we're not getting that level of partnership really coming to the table, being strategic, working together to identify plans and follow through. we're seeing slow change to that. But again, I think it's everyone kind of works in their environment, trying to hit their metrics and trying to change that mindset. And it is a mindset change. It's a cultural change for, I think, what we do, but really looking at it in a different way, in the sense of, if we don't work together, if we don't communicate, we break down these barriers, we're going to continue to see, right now, there's still a rise in serious safety events for patients. It's a third leading cause of death in the United States today, which is scary. And we still, are seeing those same issues. And I think it's because we've continued to approach it in the same way. How do we look at it differently? How do we break down silos and come together, not reactively, but proactively, to design and apply care?
Yeah, I agree. And, it doesn't surprise me that 55% of our audience said communication and teamwork. And there's something deeper than that. And that is, we can teach all the tools in the world on how to communicate effectively with somebody, how to work with another in interdisciplinary groups. However, if there is, if deeper at the foundational level, there is not a space where people feel safe, where there is psychological safety, none of those things will work. And there has to be an opportunity for organizations to create real, mindfully and intentional spaces where people feel like they belong, like their ideas are appreciated and celebrated, and that their gifts are opportunities for the organization to grow. So one of the things that we did here at Stanford, as a magnet organization, we need to have a theoretical framework that kind of frames how we do our work. And we chose a long time ago, over 15 years ago, Watson Caring Science as our theoretical framework. It is a nursing theory, but it's transdisciplinary, which means that the core message of having a emphasizing caring relationships between healthcare providers and our patients, that is a universal message for all of us that work in healthcare. So creating programs that touch members at all levels or staff at all levels, where we can have conversations about what it means to be a human, taking care of other humans, how to take care of ourselves so that we can take care of others, having permission to take care of ourselves so that we can take care of others. Having those tools in our disposal can help us then create opportunities to have more intentional discussions and conversations, so that communication and teamwork can really thrive. So, so those are some of the things that we have been trying to do here at Stanford for the past couple of years.
And Grissel, just to pivot on another question that comes to mind, what is your workforce's expectation of learning experiences you're talking about? What's missing from in-person training and e-learning in a learning management system?
I think that, when we ask our staff to tell us what are some of the things that they want tools. They want things, what I like to call point of care tools and resources that they can have easily accessible. Yes, maybe they went over that in an orientation or in a class, whether it was live or online. However, you don't retain all that information, but how can I go and get that information in another space? How can I connect with other people, almost like a cohort, so that I can continue to reflect on that information? So those are the things that I am hearing from staff when we talk about what is it that they need. And of course, access 24/7, obviously, so that they can, so it's on their fingertips. Anything that they can have on their phones, so that they can easily, whether it is a video or a quick 1-point lesson that they can pull up and look at it right away, so that they can use it as an adjunct document to help them with their work. Those are some of the things that we've been hearing. I don't know.
And Todd, just to throw it out to you, how are learning, training, and professional development organizations evolving to meet learners' expectations in your opinion?
Yeah, I think it's a handful of themes that Grissel's touched on candidly in there. There's this expectation of put things in context for me, make it sort of ease of access without question. But also this idea, it's not just about the knowledge acquisition side. It's so much about the power of the connection and the network and sort of some sense making that needs to happen across the org or between. And, candidly, almost the only way to do that is to have this sort of sense of peer collaborative social and making that kind of part and parcel. So I think you're seeing a lot of the providers out there that are really keying in to sort of the needs, not just in healthcare, but even more broadly of how do we put the human elements back into the learning experience? Because it's a really important part, especially for sort of the adult populations and workforce populations that are not just, they want that guide on the side, Grissel, not the sage on the stage. And that comes from the brilliance of peer networks that exist in the organizations, but how can they tap them in a meaningful, easy way, kind of just in time, just enough, just for me, that kind of model, but keep the context. And I thought Jolinda put a great note in the chat. I think it was around the orientation where that was failing in our opening question, but there's opportunities for reinforcement, I think was the phrase she used. And so I think you're seeing a lot of learning providers put a heavy emphasis on this idea of practice and getting to Stephanie, your point, where it's not just the smile sheets at the end of a learning experience for the provider, but can I truly see a behavioral change? Can I see an element of evidence of proof if I'm executing in a particular way? So those are a couple of ways, Michael, that I think the learning providers are trying to come meet the needs. Some of that can be technology. Some of that is outside of sort of what's top of mind today.
Okay. Let's launch another poll question to our audience. And this is, what is the most significant limitation of your current training methods? So a very big issue for folks in the audience is difficulty scheduling and attendance, and the interaction and ability to create higher engagement in in-person training. Any one of our experts want to kind of weigh in on where this all landed?
Nope. It looks, the difficulty in scheduling, that is probably one of the biggest ones. Again, this is a 24/7 business. And, when I'm pretty sure that the same thing happens with Stephanie, when we have to, when people are scheduled to do training, let's just say for the sake of argument that it's a required training, that means that we have to not only pull that person out of their schedule, now we have to find somebody to cover for that person. And if we are busy, sometimes the person is not able to come because they probably were not able to find somebody to cover for them. So then that means that that person is not going to be able to attend the class. So that becomes problematic, right? In the case of some of the courses that we teach that are voluntary, then people have to take PTO or time off or their education time. And again, that kind of, it's the same, kind of like it's the same vicious cycle. You know, you always need to find somebody to replace you, so that you can come and continue your professional development. So that is a big one. And and I
Stephanie,
know that, yeah.
Stephanie, what are your limitations?
I think all of the above. I mean, even trying to take staffing off the floors, not only are they, as I mentioned, you have to replace them, but if they're coming stressed trying to get back, how much of their mindset is there and really present to learn? And we also have to realize in any live session we do, or webinar, anything, people are only taking about 13%. So a traditional 2-hour class, is that really giving us what we need? Or do we need more microburst learning that's continuous, where they can get, where we're layering information so it doesn't seem like so much time up front. It's layered throughout a certain period of time, and they're walking away with activities and things to do. And I agree with the social aspect of it. How do we create that where they can share with others and engage? I think you asked, our traditional LMS, we don't see that. It's a one-directional learning where, you're either giving information, and there's a very limited response. There's some gamification availability, but you really don't have that interaction or the opportunity to engage as much. And so I think, we're facing all of those same challenges.
Yeah, and
Yes.
Todd, with traditional or status quo training, why is that falling short, in your opinion?
It's a consumption-based model. That's the crux of why that fails, candidly, because we, for far too long, conflated this idea that consumption equals mastery. We'll just throw more at them. We'll just assign more score modules out of this. We'll put them in another live session, and that will translate. But for the exact reasons that Stephanie said, what's their mindset coming in? What's the downstream operational implication? What's the takeaway and the opportunity to then reinforce that long tail? That just doesn't exist with the traditional models. That they were really good at the M and the S in LMS of managing and system, not so great at the L part. And so I think that's sort of a big failure point. I just, because I want to hit on the science behind what you're saying, Stephanie, this idea of spaced learning and iterative application. Maybe the folks are not using those terms, but that's what makes it really sticky. That's what makes it really impactful. And to get to the behavior change is having those components be part of the learning experience. So love that you brought that up.
Yeah, and I just want to add, humans learn in community. We learn from each other. We cannot learn in silos. We cannot learn by ourselves. We have to have that human interaction, that we can bounce off each other, ideas from each other. That we can share what our best practices are, or what are some of the things that are not working so well for us, so that others can tell us some of their best practices, and then we get an opportunity to maybe use them. So the human connection in learning is critical to really integrating knowledge that then you are able to apply it later on. So that's an important aspect of what I like to call the caring, teaching, learning model.
Right. And Todd, kind of circling back, do you think this human connection criticality is unique just to healthcare?
No, universal, and I would argue that it's becoming even more important with the nature of 5 generations in the workforce now. And I don't know, Stephanie, Grissel, if you're seeing that level of representation across your entities, but there's people want to be part of that learning experience, and they want to craft it, and they don't just want to be sort of spoken to. And so putting that human element, whether it's mentors, coaches, facilitators, together with peers as part of an ongoing learning dynamic, that's a heightened expectation, I think, cross industry, cross generation. We can't get there with sort of the old methods and old ways of operating.
So there's definitely a lot of great application from outside of healthcare that can be applied to healthcare.
Without doubt.
Let's launch our next poll question. How important is human connection in achieving effective healthcare training? We've asked our panel. Let's see what you think. 96% think it's very important. I think say we're highly aligned is an understatement. So it's great that the panel weighed in on that, and the audience definitely reflected the criticality of this human connection and training. And that leads me to my next question, Stephanie, is specifically, how does a tool like NovoEd address all of these unique training challenges that we've been speaking about?
You know, I've got to use it in several different ways. And so the one thing that I would say is it allows for, one, we talked about it has to be when the person's ready. And so it allows you to do that on demand when you're ready, when you want it. The second component is it really allows for that interaction. You can do cohort-based learning modules where you can interact with peers in addition to interacting with a facilitator or the education and modules. It allows you to break it out in bite size, you know, and really layer that iterative learning piece that Todd mentioned. And, you know, it allows you, you know, even it changes the dynamic. One of the most recent things that we did, you know, traditional competency assessments, you try to get everybody in a room and you want to check them on a competency for, you know, to do, you know, looking at quality prevention. Well, everybody has to sit there and wait, and, you know, they don't interact, or they're engaged in something else. And what I loved about this is you can video the nurse doing, you know, their whole process, and then their manager can record video feedback to them when they have time, and they can have that interaction, and they might not even be in the same room. And then other people can comment or give, if we open it up, and can comment and engage, and they can talk about best practices. So what I love about the tool more than anything, a tool is just a tool. How you use it is, you know, what makes it effective. But it does allow for that socialization of learning, which is so critical, as we all, you know, all agreed that you learn from each other and you learn by doing. But that it also allows you to really engage the learner. They own their learning journey. They own what they take away from it. We can make it fun by adding gamification or different things, but they really become the driver and the owner of that information. And that's where I think you get that commitment that Todd was talking about, is because it's really up to them to drive it forward.
Yeah, and back to you, Todd, on a couple points. A lot of folks in the audience, you know, it's really, really challenging, even if you see that it could have tremendous benefit to your organization, the effort it takes to implement a new learning system. Can you speak to how that actually happens and how it's not nearly as challenging as it needs to be?
Yeah, it's great. I'm sure all the healthcare folks were thinking of like, oh my goodness, I remember the epic rollouts and the nightmare that was to deal with those. It is nothing like a system of that. I mean, I think one of the pieces, you know, we should be doing as providers in technology, and I think we're doing a pretty good job at it at NovoEd, which is make the barrier of entry really low in terms of the folks that are designing on the platform, creating these learning experiences, that are trying to contextualize things with those engagement elements and sort of behavioral contributions, video practice, make that really simple. So it shouldn't take the old classic 150 hours of instructional design creation time for 1 hour of instruction. That is just, that's mind, like bonkers to me that if that's still the model. Doesn't mean you don't have to be thoughtful and meaningful in the objectives and the outcomes, et cetera. But you know, one of the things we're trying to do with the ease of creation as sort of a creator platform is make that barrier for the creators really low so that folks can more swiftly generate these sort of just-in-time experiences for folks and cascade them to wide audiences. And the other part is make the interaction side from the learner, from the adult side, really seamless, right? So if it's mobile is their preference, wonderful. Put it on a mobile form factor. If they prefer to be in a shared workstation, that's how they're going to access it. Make that simple. So sort of making the technology sort of fade into the background, and they can get to the meaningfulness of the interactions, because I think that's where all the change really happens. So, you know, we're talking about deployments in handfuls of weeks, not months and years. And I think, Stephanie, that was your experience with your time at Baptist, and Grissel would love your thoughts, but it's a huge piece of lowering that barrier of creation and how to spin these out in a quick order, because things change constantly and you need that freedom and flexibility.
Someone asked you, like, what are the top 3 things that should be additionally considered in modernizing their learning function? What are those top 3 things that come to mind?
Sorry, Michael, was that for me or?
Yes.
Yeah. So here's one of the so I'll give you, see if I can put these in force ranking from my side. So number one is this idea of putting the human component back in. So the idea of, yes, each individual is going to create their path the way that Stephanie's saying, but thinking about the social elements and dynamics of the learning experience, and whether you're layering in seniority and sort of junior dynamic, or it's mentor, coach, facilitator. I think thinking from the outset about the experience design and putting in those elements of additional personnel, could be teams, could be groups, could be, so again, mentor, manager, coach, facilitator. That's, I think, part of the key in modernizing. The second is this idea of making it easy for multiple folks in different parts of the org to create, because there's so much expertise, especially within healthcare. And so if that ease of creation, and it's not just, oh, there's only 2 people that can create, I think modernizing the learning function by distributing who can generate and create learning experiences, and allow that sort of building of the organizational memory and expertise to cascade would be my second one. And then I think the third one is this recognition of just the power of practice. And we talk a lot on the learning side about, if you're in the Kirkpatrick model and was it successful, can they prove they change behavior because of that learning intervention? Why wait 6 months after that experience to determine that? Why not make that part and parcel of the learning experience itself? Create practice environments the way that Stephanie was just saying, whether that's video practice or audio or submissions. Those could be peer reviewed, they could be mentor reviewed, they could be shared in a gallery. So that piece of practice elements as part and parcel to modernize, I think, is the third, perhaps most important.
For you, Grissel, what were the specific implementation steps, change management considerations, for your organization when you considered NovoEd?
Yeah, so compared to Stephanie, we are in the very novice space with NovoEd, and we've been using it for one particular course here in the Center for Education and Professional Development. And one of the things that we needed to address were how are other organizations using it? What other clients are doing? So we were able to connect with other clients to just get their lived experience with the product. And we got some wonderful ideas. So people are using it for onboarding, some people, so that was great. Connecting, we were talking about working in silos before. If we needed to work with other people within the organization, IT, security, from the perspective, IT security from the perspective of needing a single sign-on, for making sure that the platform met the key requirements that we needed, because we knew that people were going to have, some people were going to take the courses from home and things like that, and we needed to make sure that their systems were secure so that they could join the course. And of course, within our own department, it became a labor of love and a team of our nursing professional development specialists that we needed to learn very quickly the technology and how to move a course that had all these different things that we were doing, that initially was supposed to be an in-person course that then went into a Zoom with a lot of emails being sent to people, etc., to now a platform that kind of gave us the opportunity to really create the caring, healing environment that we wanted to have in our class. So those were some of the great opportunities that we had to collaborate with others.
Sure. Todd, I know this is a question that could be a webinar roundtable in and of itself, but how does a tool like NovoEd typically impact an organization, a training organization's day-to-day work? What do you see are the major impacts?
Yeah, I think, probably the single biggest one, and whether that's in the healthcare space and Grissel and sort of more nascent sort of deployment on your side, or Stephanie, you've done obviously much larger scale. It's a transformative tool set to get at behavior change, the shortest, simplest way. And learning is an unbelievably powerful lever to do that. But I think when you do it through the modality of NovoEd, selfishly, obviously, I have a point of view on this, but making that cohesive experience, Grissel, which was kind of what you were saying, where as an administrator, you were checking this spreadsheet and this live event and following up on learners and how do we nudge them to make sure they're getting back into the experience. And the whole goal behind NovoEd is to make that piece seamless from an administrative deployment side, so you can focus on what really matters, which is transforming your workforce population, educating and uplifting the nature of your employee base. And so that's kind of where we're spending a lot of time, effort, and energy, is to make that a really seamless experience for folks. And I don't know, Stephanie, if you would, because you did a ton around the onboarding component and making that kind of universal, and what that experience for you. Hopefully, we were meeting some of those needs on the administrative side and sort of ease of use and creation.
Yeah, I would say, I had a wonderful team, and you had a dynamic team that we worked with NovoEd to really design something new. We were in a crux. We went from one day we were live, the next day everything was shut down. So it was a COVID world for us, and we tried to do these recorded webinars for orientation, and they did as well as you can imagine. And people were sitting in a classroom going, please kill me. So we looked at how do we do it differently. And so we actually, it was interesting. We went outside of healthcare and found NovoEd and looked at best practices from every industry and tried to bring that together and really worked with the NovoEd team to design something. But what was great is the support on the back end, being able to run reports, where we used to have to run this report from this or do this, or each class or every component. The reporting aspect made it very simple to identify, okay, where do we see a lot of engagement? Where was there an opportunity to improve? Who wasn't compliant and who was their manager, so we could, do a nudge to them. But I will say it was kind of interesting. The one thing that we worked with is, we partnered with a designer, so we didn't have that internal capacity. So that was something that was great, because instead of going to hire someone, which we couldn't do based on, our financial situation at the time, we were able to partner with instructional designers, really get cutting edge learning in a partnership model that didn't end. And so I think that was so beneficial because we created engaging learning. We had people going, hey, I didn't get my points. I had more emails about, I didn't get my points. I did this, they were competitive. And so we had, it seemed like there was more pull versus push. And I think that was a dynamic change for us. Now, don't get me wrong, there was a learning curve on the beginning. It was, it took us about 9 weeks to kind of really get started. So not long in the overall sense. But when I talked about that agile learning theory, the ability to go in and make changes and improve consistently became just a common practice for us. And we engaged stakeholders from across our organization. They were engaged in going in and making changes. And so it became a very dynamic environment.
Michelle, your thoughts?
I agree, and I'm taking notes because I know that as we continue to grow the number of courses that we are planning to integrate into the platform, those are some of the things that we need to think about. The one thing that I forgot to include was, we have done this course. It's a cohort number 6 we just completed. I was on cohort number 4 that we decided to move it into NovoEd. And I was very impressed with the level of support, the behind the scenes support from the NovoEd group. And particularly, which was something that I was not expecting, was at the end of our first cohort 4, when it ended, they proactively came to us to share with us how we did on our first trial. I called that cohort 1, that cohort 4, it was like our first pancake. We were all learning, it's a little clunky, a little weird looking, but it just stays this, it's still delicious. But I was impressed that they kind of gave us an insight into how much engagement they were noticing from all the different activities that we had from our participants. And that kind of gave us the cues that we needed, that we were on the right track. We were able to make a couple of changes to make it a little bit easier with some of the feedback that we also had. And the class is a success. We've been able to integrate experiential learning, reflection, really create and fostering caring communities, and support the self-care of our employees, and having an opportunity for them to integrate what they're learning into an actual project that they do, that they share at the end of the didactic course. It's a 4-month course. So it's been a great experience for us.
Yeah.
Todd, I'll let you close out the thoughts here.
No, I appreciate that, Michael. One of the things I spent the first 15 years of my career on the customer side, so it's not necessarily in healthcare, but sitting in seats just as yours, Stephanie and Grissel. And Stephanie, your point is a tool is a tool. A tech is a piece of tech. And I think one of the things we've tried to take really near and dear to heart at NovoEd is we're a solution. And when we say solution, we mean, yes, we're a piece of, we think, brilliant technology, but then we're a team that sits around it, behind it, with it, and in partnership with clientele. So whether that's our experienced designers, our makers team, our core support personnel, because it takes that level of partnership, I think, in sort of today to be nimble, to be agile, to sort of provide proactive feedback on direction, because this whole learning experience design is a little bit new in terms of modality. It's not just your classic instructional design models of old with classroom-based, ILT delivery. And so we try to be a partner in all facets to that, from our makers team to our solutioning team to our strategic services team, because I think that's what it takes. It's not just hand you a piece of technology and wish you well and send you on your way, which I think I've experienced that in years past of providers promising the sun and the moon and the stars about what a piece of tech can do, and so it's a good humbling experience that hopefully we've gotten it mostly right with both of you, and we'll continue to do that because it's something that we care a lot about at NovoEd.
Well, I want to give a special thank you to the team of experts that joined us today. Grissel, Stephanie, Todd, thank you so much for joining. It was really a pleasure to listen to. I think our audience was highly engaged and had some great thoughts as well as questions. We appreciate you joining this important roundtable today. And we're going to do something for you now, which is to announce a raffle winner. So I'll turn you back over to Shay.
Awesome. Thank you so much, Michael. Yep. So before we wrap up today's webinar, I would like to announce the lucky winner of our raffle. Congrats to Marita Rito on winning today's prize, which is 50% off the 2025 Human Capital Management Excellence Conference. We will send you a code shortly to celebrate your win. Congratulations.
Congratulations. Well, thanks again for joining. This is Michael Rochelle from Brandon Hall Group signing off. Have a great day.